Have you ever felt a new ache, a little stiffness, or maybe noticed a small change in your body and just thought, oh, that's just part of getting older? Millions of us do this every day. We chalk things up to age, maybe smile about it, or sometimes just try to ignore it. It feels normal, right? But what if some of those small changes, those little things we might dismiss, are actually important signals our bodies are sending? Today, I want to talk about a topic that becomes more relevant as we age: breast cancer in older women. Now, I know hearing those words can bring up worries, but stay with me. We're going to explore it in a way that's simple, practical, and empowering. It's about understanding detection, treatment, and care in a way that makes sense for our lives. It's more than just statistics. It's about living fully, ignoring potential signs, even small ones, because we think it's just age, could mean missing an opportunity for simpler, more effective care down the line. It could impact our independence, our comfort, and the precious time we have with our loved ones. You might think that certain health issues are unavoidable as you get older, but the truth is, with knowledge and proactive steps, we often have more control and better outcomes than we realize. In this video, I'm going to walk you through 5 crucial things you need to know about breast cancer specifically as an older woman. We'll cover simple but vital points about what to look for, how treatment can be tailored to you, and how to focus on care that supports your quality of life. These are practical insights you can use right away to feel more informed and confident about your health. Before we dive into these important points, if the topic of staying healthy and informed as we age resonates with you, please go ahead and hit that like button right now. It really helps this information reach more people who need it. And if you haven't already, make sure to subscribe to the channel and ring the notification bell so you don't miss out on future health tips tailored just for you. Let me know you're with me by commenting health below right now. All right, let's start with the first key point you need to understand about breast cancer and aging. Point 1. Why paying attention to body changes is still crucial as you age. It's easy to think that as we age, our bodies are just naturally changing, and we might not need to be as vigilant about things like breast checks or mammograms. But here's the simple truth: the risk of breast cancer actually increases with age. While some breast cancers in older women might grow slower, detecting any cancer early, regardless of age, almost always leads to more options and less aggressive treatments. Your body is still a valuable vessel, and its signals matter just as much now as they ever did. I saw this with my friend Eleanor. She found a small lump, maybe the size of a pea, but she was in her late 70s and had some other health issues. So she thought, oh, it's probably just a cyst, or maybe just normal lumpy tissue. I'm too old for this to be serious now. She waited a few months before mentioning it to her doctor. By then, it had grown slightly, and while the treatment was still effective, her doctor told her that if she had come in right away, the removal might have been even simpler and the follow-up less involved. Eleanor told me later how she regretted waiting, wishing she hadn't just dismissed it as an old age thing. The personal impact here is clear. Dismissing a symptom because you think it's normal for your age isn't just about potentially missing cancer. It's about potentially undergoing a more complex diagnostic process or treatment than you would have needed if it were caught earlier. Early detection often means simpler surgery, less extensive treatment, and a quicker return to your normal activities. So the simple advice here is, never assume a change in your body is just age. If something feels or looks different, get it checked out by your doctor. It's always better to be safe and find out it's nothing serious. All right, now that we know why we need to pay attention, let's talk about what specific signs you should be looking for. Point 2. Recognizing key signs and symptoms beyond just a lump. Most people know to look for a lump, and yes, that's important. But breast cancer doesn't always show up as a noticeable lump, especially in older women. It's crucial to be aware of other potential signs too. These can include changes in the skin texture, like dimpling that looks like an orange peel, changes in the nipple, such as turning inward, redness, or discharge, redness, swelling, or warmth of the breast, or even persistent pain in a specific area. Sometimes a cancerous lump isn't even painful. Think about Martha. She didn't feel a lump at all. What she noticed was that her nipple started to look a little different, kind of pulled inward slightly, and there was a clear discharge sometimes. She hesitated to go to the doctor because she was a bit embarrassed and thought it might be hormonal changes from aging. Her daughter finally encouraged her to get it checked. It turned out to be a small cancer located right behind the nipple. Because she finally sought medical attention, even though it wasn't a typical lump, they caught it relatively early, and her treatment plan was focused and effective. Knowing these other signs empowers you. You're not just relying on finding a lump. Being aware of the full range of possibilities allows you to recognize changes that might otherwise go unnoticed, leading to earlier detection and better outcomes. The practical tip here is simple. Get to know what your breasts normally look and feel like. You don't necessarily need to do a formal self-exam if that feels difficult, but just being generally familiar with your body is helpful. And importantly, if you notice any change that is new or unusual for you, no matter how small or seemingly insignificant, pick up the phone and call your doctor. By the way, if you're finding this information valuable, give us a comment with your biggest takeaway so far. Okay, so we know what to look for, but what about the regular checkups? Point 3. Why regular mammograms can still be your best friend. You might wonder if you still need mammograms as you get older, especially if you've had many over the years. The answer for many women is yes. Mammograms are still the most effective tool we have for detecting breast cancer early, often finding changes long before you can feel them yourself. While guidelines for screening frequency can vary based on your health and age, ongoing discussions with your doctor about whether mammograms are right for you are vital. Screening isn't something that automatically stops at a certain birthday. My friend Dorothy, she was 82 and feeling perfectly healthy. She almost skipped her annual mammogram appointment. She told me, honestly, I thought, what's the point? I feel fine. If something is there at my age, what will they even do? But she went anyway, just out of habit. And that mammogram found a tiny, early stage cancer that she couldn't feel at all. Because it was caught so early, her treatment was minimal and highly successful, with very little disruption to her active life. It was a powerful reminder that feeling healthy doesn't mean skipping screening. The impact: regular screening provides invaluable peace of mind if everything is clear, and if something is found, it's much more likely to be at an early, highly treatable stage. This gives you the best chance for effective treatment with the fewest side effects, allowing you to maintain your health and lifestyle. My practical advice here is simple. Talk to your primary care physician or your gynecologist about their recommendations for your breast cancer screening based on your personal health history and overall health. Don't just assume you can stop. If they recommend a mammogram, try your best to get it done. Now, if a concern is found, the next natural question is about treatment. Point 4. Understanding that breast cancer treatment is tailored to older women. When breast cancer is diagnosed in an older woman, the treatment plan is often very carefully personalized. Doctors take into account not just the type and stage of the cancer, but also your overall health, any other medical conditions you have, and very importantly, your own preferences and goals for treatment. Treatment options can range from surgery, which might be less extensive, like a lumpectomy, to radiation, hormone therapy, which is often very effective and less taxing, or chemotherapy, which might be given in a modified way or only if absolutely necessary. My friend Barbara was diagnosed with breast cancer at 75. She was very worried about the idea of chemotherapy, picturing herself being very sick and losing all her energy. But her oncologist explained that because her specific type of cancer was hormone receptor positive, the main treatment recommended was hormone therapy pills, taken daily. This treatment was much gentler than chemo. While there were some minor side effects, Barbara was able to continue living at home, going for her daily walks, and seeing her grandchildren regularly. Her treatment was effective, and it allowed her to maintain a good quality of life throughout. The key takeaway is, you have options, and your age doesn't mean you automatically get the most aggressive treatment or no treatment at all. Treatment for older adults is designed to be effective while minimizing side effects and preserving your ability to live comfortably and independently. My practical advice: when discussing treatment options with your doctor, don't hesitate to ask how each option might impact your daily life, your energy levels, and any other health conditions you have. Share your priorities. Is maintaining energy most important or minimizing travel for appointments? Your input is crucial in creating a plan that's right for you. Have you ever had a health experience where personalized care made a big difference? Share it below. Finally, let's talk about living well during and after treatment. Point 5. The power of supportive care and focusing on quality of life. Undergoing treatment for breast cancer isn't just about targeting the cancer itself, it's also about supporting your entire well being. This is where supportive care comes in. It includes managing side effects like fatigue or nausea, addressing emotional needs like anxiety or stress, ensuring good nutrition, incorporating gentle physical activity if possible, and leaning on your support network. For older adults, maintaining strength, mobility, and independence is often a primary goal, and supportive care is key to achieving that. I know a wonderful woman named Mildred. When she was going through breast cancer treatment, she made it a point to go for a short walk every single day, even if it was just around her garden. She also worked closely with a nutritionist to make sure she was getting adequate protein and nutrients to keep her strength up. Mildred told me that focusing on these simple things, moving her body gently and eating well, made her feel more in control and gave her energy to handle her appointments and treatments better. It wasn't just about fighting cancer, it was about living well while fighting it. The impact of supportive care is huge. It can help you feel better day to day, manage treatment side effects more effectively, reduce stress, and most importantly, help you maintain your energy and ability to do the things you enjoy. It's about ensuring that cancer and its treatment don't completely take over your life. My practical advice: don't try to tough it out alone. Talk to your doctor or oncology nurse about any symptoms or side effects you're experiencing, even if they seem minor. Ask about resources like nutritionists, physical therapists who specialize in cancer care, or support groups for older adults. Accept help from friends and family. Simple things like having someone drive you to appointments or prepare a meal can make a world of difference. This brings us to thinking about practical steps we can all take. Beyond the key points we discussed, here are a few more practical tips. To make checking yourself simpler, try to do it consistently, maybe while getting dressed or taking a shower. Just feel gently and look for anything new or different. When you go to your doctor's appointments, write down your questions beforehand. It's easy to forget in the moment. Ask them about your specific cancer type if diagnosed, the recommended treatment and why, potential side effects, and who to call if you have problems. Some common mistakes to avoid include delaying your doctor's visit. If you notice a change, procrastination can be costly. Another mistake is assuming any lump or change is harmless. Let a doctor make that call. Don't be afraid to discuss all your health conditions and medications with your cancer care team, as they need the full picture to plan safely. And please, don't isolate yourself. Support is available and incredibly helpful. While mammography is the standard, sometimes other imaging like ultrasound or MRI might be used, but your doctor will guide that. Remember, support can come from many places: of formal groups, friends, family, or online communities tailored for older adults. A crucial piece of advice: this video provides general information for educational purposes. It is not a substitute for professional medical advice. Always discuss your specific health concerns, symptoms, potential diagnosis, and treatment options with a qualified doctor or healthcare provider. They can provide guidance tailored to your unique situation. Let's quickly recap the big picture. By staying aware of your body, getting recommended screenings, understanding your treatment options, and focusing on supportive care, you significantly increase your chances of catching any potential issue early, having simpler and more effective treatment, and maintaining your health and quality of life for years to come. None of these steps are overwhelmingly complicated. It's about simple awareness and taking action when needed. It's about having a conversation with your doctor and making informed choices for yourself. It's truly within your reach to take these steps. I know it can feel challenging to face health worries, and it might seem easier to just ignore things. But neglecting those little signals or avoiding checkups, while seemingly easier in the short term, can unfortunately lead to bigger problems down the road. It could mean more difficult treatments, more worry, and potentially missing out on time and activities you cherish. You deserve to feel your best and live your life to the fullest. But here's the powerful truth. Age is truly just a number when it comes to prioritizing your health and happiness. You have the wisdom of years and the strength to make choices that benefit you. It is absolutely, unequivocally, not too late to start paying closer attention, to schedule that checkup, or to ask those questions you've been holding on to. You have the power to choose a future where you feel informed, empowered, and proactive about your well being. Choose that future for yourself. So, as we wrap up, remember that staying informed about breast health in older age isn't about living in fear. It's an act of self love and strength. It's about being proactive so you can continue to enjoy your independence, your family, your hobbies, and all the beautiful moments life has to offer without unnecessary health worries holding you back. It's about preserving your ability to live life on your own terms for as long as possible. After watching this video, what is one small step you feel you can take towards better breast health this week? Share your personal commitment or any lingering questions in the comments section below. I love reading your thoughts and experiences. If you found this discussion helpful and reassuring, please give this video a thumbs up and hit that like button. And if you haven't already, make sure you are subscribed to the channel for more practical health insights. Most importantly, if you have a mother, grandmother, aunt, sister, or dear friend who is an older woman, please consider sharing this video with them. This information could be exactly what they need to hear right now. Sharing is caring, and this knowledge could truly make a significant positive difference in someone's life. Thank you so much for spending this time with me. Wishing you and your loved ones the very best of health, peace, and happiness. Take good care of yourselves, and I look forward to seeing you in the next video.